Okay, this is how we clean Doug's trach tubes. Since we change them out several times a week, you can see it looks fairly clean, but you can see that the peroxide is bubbling, and you see a little yellow in here, so there's a little mucus or a little bit of biofilm from just the amount of stuff. This one did not have a plug at the end, but you'll see one of the things I do is I turn it around as I come up. Now, if you have a smaller tracheostomy tube, you don't have this benefit because you can only use the bottle brush on the outside. But when you have a 7 or larger, usually you can get this brush in. And then we also, of course, brush around the outside to try and make sure that anything is on the outside. We're also going to clean it with some gauze. And then I go back in one more time. This is probably one of the cleaner ones we've had, but it always makes Doug feel better to have a clean one. And so we just spin the brush around, especially as we get to the connector where it's green. And this is, you'll see there's just a little mucus on the end, but really not much of anything. If you want to back up a little bit. So we'll throw away the brush, and then all we do is we pour peroxide through it a couple times. And then we put it in the sterile water. We get another gauze square. And if it looks at all suspicious to us, these are getting old, they're about to be replaced. You can see that it's a lot yellower right around there. You can use the Q-tips that come with it, but my experience is they don't do a lot to get off that last little bit. Sometimes you can get it in at the curve, sometimes you have to go back to putting 2 straight ones in, but it's pretty hard once they are aged out. These trachs are probably, I'm going to guess, at least 4 months old. So you wipe it off on the sterile, the part you need to keep the most clean first, and then the second part, and then the flanges. I'm going to throw away my pipe cleaner, and then with the opposite side I'm going to dry the obturator, place it in there, and once again just wipe down just to make sure everything's dry before I put it in the package again. Then we put it back in our sterile, well, thankfully it was in a closed package. Put it back in our, between 2 pieces of sterile gauze. Some people put them in baggies, we just put them back in the boxes. Haven't had a problem so far. And then it's ready to use the next time we change out his trach.